Hi, everybody. It's Dr. Kerry Reller, your board certified family and obesity medicine physician, here to talk to you today about cholesterol. I'm going to share my screen. So, how can we improve your LDL cholesterol? So, first of all, why do we care about cholesterol? Cholesterol is a fat substance in your blood that can be made by the liver, or you can ingest it in the form of food, and it builds up on the inner walls of your arteries. When the arteries get filled with this substance, they can get clogged and narrow, and then blood flow will be reduced. If we're talking about the blood flow to your heart, when those arteries get clogged and narrowed, then they can cause chest pain. If some of that cholesterol flicks off and makes, or a blood clot forms and it ends up blocking the artery, that's how a heart attack can happen. The same thing can happen with the brain, with arteries to the brain if they're blocked, and that would cause a stroke. So why is fat or cholesterol important? So fat is the major storage form of energy in the body. It's important in immune function. It's important with cell membranes. It helps keep your skin healthy. It's important in brain tissue. It's also important in hormone synthesis to help make estrogen and testosterone. It's important in vitamin D synthesis and bile acid synthesis, which is used to help digest food. It's required. You need cholesterol to absorb vitamins A, D, E, and K. Those are the fat-soluble vitamins. Without cholesterol, they cannot be absorbed. Essential fats like omega-3 and omega-6 are important for heart health. Essential means that they cannot be made by the body. They have to be eaten in some form. Healthy fats can help lower that LDL. And fat is also something that adds flavor to food. It makes it, more enjoyable. And fat also helps keep you satisfied longer after a meal. So typically when we do a cholesterol panel, we see high cholesterol, we recommend lifestyle changes first to improve your cholesterol. That would include eating heart healthy foods that we will talk about in a few moments, reaching and maintaining a healthy weight, being physically active, and avoiding smoking. Now, typically, we're going to go into more detail basically on the different types of cholesterol, but losing like 3 to 5% of your body weight typically improves your HDL cholesterol by making it higher and improving your triglycerides by making those lower. More like 10% of body weight is needed to improve the LDL cholesterol. So what is high cholesterol? Most labs will define high cholesterol as a total cholesterol greater than 200. For the LDL, it's usually anything greater than 100 is considered high cholesterol. If you have had a higher heart attack or a stroke, usually your goal LDL is actually going to be less than 70. And typically that's when they would definitely recommend a medication called a statin. If your LDL is greater than 190, that's another time where medication may be recommended, obviously in addition to lifestyle modifications. But since it's so high, they usually recommend actually starting a medicine at that time. And high triglycerides are actually defined as greater than 150. Anyway, so LDL cholesterol, we call L for lousy cholesterol. So that one picks up the cholesterol in the blood and deposits it on artery walls. HDL is the good cholesterol. We want it to be H for high or healthy. HDL cholesterol actually picks up the bad LDL cholesterol and brings it to the liver to be recycled. When we look at cholesterol, we don't just look at all these numbers. We also look at a ratio between either the total cholesterol and HDL or total cholesterol and LDL or HDL to LDL to determine basically a more complete cardiovascular risk profile. So here is just basically a graph showing that elevated plasma cholesterol levels show that there's an increase in coronary risk ratio. There's also, like I said, of importance of looking at the other parameters like HDL and the triglycerides. So this is not to be end all or do all anymore, but it is important to see that as a greater risk factor. So, which fat is which? So, in 2018, the FDA implemented its 2015 ruling that partially hydrogenated vegetable oils are no longer regarded as safe. So they removed those from the United States food supply. And that is basically pointing at the industrial trans fatty acids. So those are something we always want to recommend avoiding. Trans saturated fat, avoid it. Those are usually from processed or commercially prepared foods. I don't know if you remember, but Girl Scout cookies used to have trans saturated fats. And when the FDA passed this law, they had to remove the trans fats from their recipe. So saturated fats are typically from animal products. We want to reduce or limit saturated fats. And then the plant products usually have the unsaturated fat, and those are considered healthy. They bring up the HDL, they help lower the LDL. So we want to eat more of the unsaturated fats. And I'm not going to get into the details, but more specifically, the polyunsaturated, a little bit more than the monounsaturated fats. So typically the foods that we recommend to eat to improve your cholesterol profile would be lean meats like poultry, like turkey or chicken, and without the skin. The skin has more fat. Lean cuts of beef, and usually trimming any fat off, as much fat off as possible. Typically the loin or round cuts have the least amount of fat. I know skirt and flank steak have lower fat too. So those could be good options. So the United States Department of Agriculture defines lean meat for a serving size of 3.5 ounces of less than 10 grams of fat, and 4.5 grams of that would be saturated. And they defined extra lean as less than 5 grams of fat or less than 2 grams of saturated. Other really good foods to eat to help lower that LDL would be the salmon, the fatty fish, the albacore, tuna, sardines, if you like those. And we recommend usually 8 ounces of non-fried fish per week, and that can be separated in multiple doses. Also, unsalted nuts, seeds, legumes, things like that are very healthy to help lower the LDL. And you want to use non-tropical vegetable oils like canola, corn, olive, or safflower oils. So I'm going to bring up dairy, but it's very controversial at this time. So typically they used to recommend fat-free 1% or low-fat milk products. But the biggest thing was that these products are often adding added sugar or maybe fake sugar. And I think substituting the full fat dairy product for the low fat, but with added carbohydrate or sugar, did not help improve cardiovascular risk. But this is still controversial, and you'll see that on the next slide too. So foods to limit, basically red meat, fatty meats, especially if they're not trimmed, processed meats that have more sodium like sausage and things like that. Baked goods, donuts, cookies, cakes, they have lots of, they possibly have trans fat in them, and definitely a lot of saturated fat. The hydrogenated oils are mostly just trans saturated fats and should be avoided. Other saturated oils like coconut, palm, and palm kernel oil, should be limited. You could, use the other better oils that we mentioned previously for a better replacement. And then solid fats like shortening, stick margarine, or lard. And then obviously fried foods. And then once again, the full fat dairy topic is very controversial. Basically, you don't want to substitute carbs for saturated fats because it doesn't reduce the cardiovascular risk. So cooking tips. So basically, getting rid of fat is the goal, right? So you can use a rack to drain off the fat when you broil, roast, or bake poultry and meats. A lot of ovens come with broiler pans that help drain off the fat underneath. You can look for leaner cuts of meat if you choose to eat meat, like we mentioned before. You can rinse meat with a colander if you're using higher fat meat for a sauce or something where you're not really going to notice because you're pouring it in a sauce. And we usually don't baste the meat with drippings, just use wine or marinade. And broiling or grilling instead of pan frying helps. And better yet, air fry. which is a newer thing on the market. And then you want to cut off all the visible fat from the meat before cooking it, remove the skin from the poultry pieces. You can use a vegetable oil spray to brown or saute foods instead of like butter. And you can just in general, serve smaller portions of these higher calorie dishes that have full fat. And you shouldn't need that much of them anyway, because what did I say earlier? That makes you more full, right? So these are my references. And if you have any more questions, you can come work with me. It can be found on all these different places. And I'm going to stop sharing here. And I just wanted to bring up a picture of Land O'Lakes butter, which can't be seen, but here we go. Can you guess how much saturated fat is in 1 tablespoon of butter? So the total fat is 11 grams. How much do you think of that is saturated? Well, it's 7 grams. So the nutrition fact label do not have to include unsaturated, but they do need to include saturated and trans-saturated fats. So they don't have listed, obviously, the unsaturated on here, but I'm going to guess it's 4 grams. So in case you didn't know, a tablespoon of butter has 11 grams of fat and 7 grams of saturated fat. So there's better options for that. Then we have the other recommended thing, extra virgin olive oil. You can see that. And how much fat and saturated fat do you think is in that? So there are 14 grams of total fat, 2 grams of saturated fat, 2 grams of polyunsaturated fat, and 10 grams of monounsaturated fat. So you're going to get plenty of the unsaturated healthy fats from this and just a little bit of the saturated. Then I have canola oil. So there are 14 grams of fat for this, 1 gram of saturated fat, 0 grams of trans fat, 4 grams of polyunsaturated fat, and 9 grams of monounsaturated fat. So that is also another great option instead of, butter to cook, onions or saute anything in as well. So that's all I have for you today. Once again, you can find me on any of those things that I put up earlier. And I hope you look for the next video that I'm going to make for you and that we keep learning together. Have an awesome day.